Assalamu alaikum. Yes, the second question of your medicinal chemistry. Okay, in previous video we discussed about the first important question of a 10 mark. Here let's discuss about the second question, and this question I selected from the RGHS University. See, Rajiv Gandhi University of Health Science. Only question papers we are solving. From 2 days we are solving the question papers. So in your mind there is one question, sir, is these questions will be related to other universities like AKTU, BPTU, other universities? Yes, 100%. The other university also the questions are same, approximately same questions. So if you practice these questions means you are on the safe side. Okay, not only I am discussing about RGS University, all university which comes under Pharmacy Council of India, PCI. Don't worry, go through these questions, you will pass your examination. Okay, yeah. See here, the next question is define and classify sedative and hypnotic, giving example with one structure from each class. Discuss the structure activity relationship of benzodiazepines. See here, this question asked from the year 2020. See this one. Define and classify sedatives, hypnotic, giving examples, one structure and a essay of benzodiazepines. Let's discuss about the answer of that question, how to write, what to write the content, then only you will get the 10 out of 7 or 8. So first you write the what is the sedative. Sedative, you know that a drug or substance used to calm a person down, relieve anxiety or help a person sleep. Mainly these sedatives are a sleep inducing drug. Just they give a relax to the patient. Here no forcing the patient to sleep. One difference in sedative and hypnotics is in sedative there is no forcing for the patient to sleep, just calm and relaxing for the mind. Now in hypnotics, see, the drug produces a drowsiness, forcing the patient to sleep by depressing the control nervous system. Here the drug, okay, it is forcing the person, the patient, to sleep, to calm down, to sleep. Automatically what it will do, these drugs will depress the control nervous system and it tends to sleep. Where in the hypnotics? Clear, this point is very important. Now the classification of these hypnotics and sedatives are barbiturates, benzodiazepines, non-benzodiazepines, alcohol and carbamate, amides and imides. These all are the 5 classification which comes under these hypnotics and sedatives. Now first we discuss about the barbiturates. Okay, you write this one, barbiturates. These are the derivatives of 2,4,6 dioxohexahydropyrimidine that reversibly depress the activity of all excited tissues. Basically what happens, you know, the excitement of the tissues will be controlled or will be inhibited by these barbiturates. For an example, see what happens in your brain. There are many brain cells, tissues are there. So their excitement means overreactivity. Okay, these drugs, which one, sedatives and hypnotics, they will depress the action of those excited tissues or brain cells. Then only your body calms down, your brain calms down, then you can feel relaxed. These all are synthesized by the condensation malonic acid derivatives with urea derivatives. See, example is phenobarbital. They are long acting barbiturates. Which one? Phenobarbital. You have to give only one example here, it's enough. See, phenobarbital, this is a structure of the phenobarbital. Just one point here in medicinal chemistry is only one you can easily pass, but the one important concept you have to remember here is you have to practice these structures. These structures are very important. See, one is means nitrogen is attached, double bond O, oxygen is attached, ethyl group is attached here. See, these are very important. It is used to control seizures, used to relieve the anxiety, or it is used to treat the wakefulness. So these are the very important one. Which one? Phenobarbital. It comes under the barbiturates. Next, benzodiazepines, diazepam. It is the sleep inducing drug, diazepam. See, this is the structure of diazepam. 2 benzene ring, 1 benzene attached with the chlorine. This one is the side attached room or side attached ring. Uses, it is used to relieve anxiety, used to control agitation caused by the alcohol withdrawal. Some persons or some patients or some consumers of the alcohol, suddenly withdrawal of the alcohol, their mind changes, means they feel some of the agitation or adverse reaction to the environment. To control that adverse reaction, we are giving this diazepam. Non-benzodiazepines, see zolpidem, it is one of the best example for non-benzodiazepines. It is the example, it is used to treat insomnia, means sleep. It is used to treat sleeplessness. Those patients who are not asleep in the night, to treat them we are giving this one. Simple in your words. See, this is the structure of diazepam. Here my work is just under explain the concept, but your work is major here. You have to practice these structures. Without practicing these structures, no, you cannot. Yes, after non-benzodiazepines come across the alcohol and carbamate. It is also one of the classification of the hypnotics and sedatives. Meprobamate, it is a tranquilizer. See, the structure of this is meprobamate. It is used to treat anxiety disorders, used for short-term relief of the symptoms of anxiety in adults and children 6 years of age and also older. Then last classification, amides and imides. Glutamide, okay, glutathione. This is the structure of glutathione. It is used to treat insomnia. It is used to give the patients who cannot tolerate barbiturates. One point I want to tell you, if you don't know anything, means for these sedatives and hypnotics, you write for all if users, you write here. It is used to treat the anxiety, used to refresh the mind. It is used to make the person relax. Okay, it is used to depress the control nerve system. These points, these basic points, if you write in our answer sheet, means definitely you will get marks. But very important here is the structure is very important. First they will observe the structure. Then SAR of benzodiazepines, structure activity relationship of this benzodiazepines, one of the very important. These are the three ring 1, ring B and ring C. In ring A, understand this concept. In ring A at 7th position, attachment of the electron withdrawing group like chlorine, bromine, nitrogen or cyanide will increase the activity like fluorazepam. Fluorazepam, very simple. 7th position. See, what's the 7th position here? Numbering from here. 1, 2, 3, 4. Okay, 4, 5, 6, 7. At 7th position, if you add chlorine, bromine, nitrogen or cyanide, what happens? Automatically here, the activity of these benzodiazepines increases. Okay, the potent action of this benzodiazepines increases. Now ಇದರದು ಇನ್ಕ್ರೀಸ್ ಮಾಡಬಹುದು, ಆಕ್ಷನ್ ರೋಗಿಗಳಿಗೆ ಟ್ರೀಟ್ ಮಾಡುವ ಆಕ್ಷನ್ ಅನ್ನು ಇನ್ಕ್ರೀಸ್ ಮಾಡಬಹುದು. ओके, हम इससे ओके टू एडिंग द 7th पोजीशन, हम ये ऐड करने से इनकी पोजीशन को या इनके पोटेंट नेचर को इंक्रीज कर सकते हैं, मेडिसिन प्रॉपर्टी इंक्रीज कर सकते हैं. ओके, अंडरस्टैंड दिस वन. एग्जाम्पल हम इधर फ्लोराजिपाम दिए हैं. If we add any substitute at position 6th, 8th, 9th in the ring, then the activity decreases. Agar if we add here, where here it is the 6th position, if we add here any chlorine, bromine, nitrogen, cyanide, means automatically what happens? It will decreases the activity. There is no increase of the potent action of these barbiturates. Automatically the action will be decreases. Understand this concept. Now let's move towards the ring B. In ring B, substitution of alkyl group like CS3 or C2H5 at position 1st on nitrogen will increase activity. Fluorazepam. Very simple. In ring B, here see, for the nitrogen, above group is alkyl group. For if the alkyl group is present, means it is the compulsory here. Alkyl group is compulsory. It is very good. If alkyl group is present, means the automatically the action of the benzodiazepines increases. If it is absent, means okay, no potent action. Now here one more point, carbonyl group C double bond O present at position 2nd is essential and good for activity. One more point, see, you are observing here at the 2nd position C double bond O, it is the carbonyl group. So this carbonyl group at the 2nd position is mandatory. If it is absent, means here also you will face a problem of a decrease in potent action of these benzodiazepines. Replacement of this carbonyl function with 2 hydrogen atom gives medazepam, which is less effective. See, medazepam, it is also one of the barbiturates. It is also one of the benzodiazepine. Here what happens, if you replace the carbonyl group, if you replace this one and you add here hydrogen, H means, then also their potent action of the drug decreases. Like for an example, you will get medazepam. Medazepam, it is less active than the fluorazepam. Very simple one. See, in structure activity relationship, very important concept you have to remember here is what happens to the structure if we changes. That's the point here. ನಾವು ಏನಾರು ಸ್ಟ್ರಕ್ಚರಲ್ಲಿ चेंजेस ಮಾಡಿದರೆ ಏನಾಗ್ತೈತೆಪ್ಪ, अगर हम स्ट्रक्चर के अंदर चेंज करेंगे तो क्या हमें व्यत्यास दिखेगा. क्या स्ट्रक्चर का एक्टिविटी इंक्रीज रहता है या डिक्रीज रहता है? दैट्स द पॉइंट हियर, वेरी सिंपल. Okay, that is known as a structure activity relationship. Very important. Then by replacing one of the hydrogen with the OH group at position third lowers the activity and facilitates elimination. Third group, here see, there is no carbamyl group. Just if we replace this one with the hydrogen, means here also there will be decrease in the activity. Then attachment of carbamyl group at third position increase the duration of action, forms water soluble. Yes, if we attack here carbamyl group third position, means yes, here we are having the chance of increasing the potent action. Now at the position 4th and 5th, double bond is good for activity. Saturation of this reduces potency. Understand the concept here. See, at the 5th position, if you remove this saturation, means if you remove this bond, means what happens? It convert to the saturation. If you can remove this unsaturated bond, double bond means unsaturated bond, then what happen? The removal of these double bond will lead to single bond. That single bond, it is not good for the activity, it is not good for the potent action. So automatically your action of the drug, your action for the sedatives and hypnotics decreases. Now last is ring C. Phenyl substitution at position 5th increases activity. See, this one is the position 5th. Here what we are doing, we are just substituting one phenyl group here, benzene group, very important group this one. Here if we add that, means then only our activity increases. Attachment of an electronegative substitution like chlorine, fluorine at ortho and diortho position will increase activity. If we attach here any chlorine, fluorine or at the ortho position, means yes, we can increase our activity. We can increase our activity. Then by replacing this benzene ring with aromatic heterocyclic ring, increases anxiolytic properties. Ripazepam. Anxiolytic means it is also an anxiety drug, anti-anxiety drug, means which is used to give to prevent the sleep disorders. See here, if you attach one of the heterocyclic compound like pyrazole, then automatically yes, 110% the activity of this benzodiazepines increases. Yeah, yes, my dear brothers and sisters, this is the important question. Now let's discuss with the next third question. The third question, this question asked in the year 2020. See, what I want to explain you here. See, write the SAR of benzodiazepines, outline the synthesis of diazepam. Here you have to write same SAR of benzodiazepine, not what we have discussed now in the previous question, in the second question. You have to write this one. But before writing this SAR, first you write what are these hypnotics and sedatives, then you write classification. After that you go for SAR. Okay, it is mandatory. They are not given here, but you have to follow this procedure. After writing this SAR, you have to write the synthesis of the diazepam. Now let's discuss about this diazepam structure, synthesize. So diazepam, it is also a hypnotic and sedative. We know that all. Barbiturate, yes, it is also one hypnotic and sedative. See, 2-amino 5-chlorobenzophene react with the glycine ethyl ester. There will be formation of one product. Okay, the combined product. If we attach both these, means we will get one complex product. That complex product, if we conduct methylation in the presence of aluminum trichloride, there will be formation of a diazepam and liberation of hydrogen iodide. Okay, this one you have to follow. One point you have to remember here, you have to know the joining of the structure. How can you join? See, these are same, just you have to remove this one and join. These glycine ethyl ester you have to join to this 2-amino 5-chlorobenzophenone. Then you will get one structure, complex structure. That complex structure, if you react with aluminum trichloride under the observation of methylation, then you will get one product, diazepam. Very simple. By practicing once or twice, you can come through this. Yes, our last question of today's discussion, fourth question. What are anti-inflammatory agents? Classify them with example, discuss their mechanism of action, write the synthesis of mefenamic acid. See, 2022, this question was asked. Okay, yes, previous in the year June 2022. First we have to write here what is anti-inflammatory agent. Simple, it is used for the treatment of minor pains and for the management of edema, means swelling and tissue damage resulting from inflammatory joint disease. Simple, if you don't know these all things, means you write anti-inflammatory agent. These are the drugs or the chemical substances which are used to treat the swelling. Simple, they are mainly used to prevent inflammation of the tissues. Then here, mechanism of action. For all anti-inflammatory agent, there is the same mechanism of action. If you write the same mechanism of action, means you will get the good marks here. The major mechanism of anti-inflammatory drugs will be inhibit prostaglandin synthesis. Very important point here. See, for in any, for an example, this is the tissue. Now in this tissue, what happens, if the bacteria enters, means they start to synthesize this prostaglandins. If we inhibit this synthesis of the prostaglandin, means we will not get a swelling. So the all action these conducted by these anti-inflammatory drugs, okay, like anti-inflammatory agents competitively inhibit cyclooxygenases, the enzyme that catalyzes the synthesis of the cyclic endoperoxides to form the prostaglandins. Automatically these agents, they will inhibit these cyclooxygenases. It is an enzyme that will catalyze the synthesis of the cyclic endoperoxides, okay, to form the prostaglandins. If prostaglandins are unable to form, means there is no chance of inflammation. Generally anti-inflammatory agents inhibit both COX1 and COX2. What is the COX? COX is nothing but a cyclooxygenases. It is the enzyme, okay, both 1 and 2 is inhibited by these agents. The other way, these will also reduce the production of the superoxide radicals. We discussed in the pathophysiology this one, okay. Inflammation occurs by the deposition of the superoxide oxides like O2 or nitrogens, okay, and reduce the pro-inflammatory cytokine levels, decrease nitric oxide synthesis. Very simple. See, anti-inflammatory agent, it will inhibit the cyclooxygenase 1 and 2, then decrease of prostaglandin synthesis, automatically it will reduces the swelling. Classification of anti-inflammatory agents: salicylates, propanoic acids, that is profens, aryl and heteroaryl acetic acids, then phenamates, anthranilates, means phenamates, it is also known as anthralinates and halides. Now let's discuss with first one, salicylates. What is this salicylates? These are potent anti-inflammatory agent. Example is a sodium salicylate. Example C, sodium salicylate. It is used to relieve the pain and rheumatic fever, means mainly pain. If a pain in the body is absorbed, means there is a chance of inflammation. Simple. Magnesium salicylate also used as an anti-inflammatory agent. Then propanoic acid. Propionic acid is also known as profins. Propionic acid, if you don't know to remember this one, you can remember profins. They are more lipophilic compounds than salicylic acid. One point you remember here, very important one. See, in our human body, the most or the maximum deposition or the maximum involvement of the lipid content. Okay, now see, this is the cell membrane. If the drug want to pass this cell membrane to show its activity, means it want to pass through the lipid content cell wall. Okay, so if the drug is more soluble in our lipid, means then only it shows its good action. So this propanoic acid, it is having the good lipophilic property. Alpha CSA substitute present in the profins increases the cyclohexogenase inhibitory activity and reduces toxicity and profins. See this one, CS3. This CS3 alpha substituted methyl group, it will increases the activity, it will inhibit the cyclohexogenase and reduce the toxicity of the profins. Naproxen, generally you will get that naproxen 500, naproxen 250 to relieve the pain, headache. We are giving this one. This is the structure of the naproxen. Next one, let's move towards the aryl and heteroaryl acetic acid. See, these compounds are also derivatives of acetic acid, but in this case, the substituent at the second position is heterocyclic or related carbon cycle. Yes, second position attached of the heterocyclic etodolac. See, it is the NSAID, non-steroid anti-inflammatory, used to treat the mild or moderate pain. It helps to relieve the symptoms of arthritis. Now here the last, means after this video I am going to tell you very important point. By this point you will get the 10 marks. So watch the video until last. Next one is the next classification is anthranilates. These are also known as the phenamates. Mefenamic acid, one of the example for this phenamates. Yes, this is the mefenamic acid structure. They are used to relieve mild to moderate pain, specialist in menstrual pain. So you are observing that many females, they are observing the menstrual pain, bleeding pain, okay, menses pain. To treat this all menses pain, menstrual pain, bleeding pain, we are giving this mefenamic acid because it is a NSAID, non-steroidal anti-inflammatory drug, okay, and also anti-inflammatory drug. Yes, my dear brothers and sisters, these are very very important question for your examination. So you go through these questions. Synthesis of mefenamic acid. Very simple synthesizes 2-chlorobenzoic acid react with the 2,3 xylidine in the presence of potassium carbamide H plus formation of mefenamic acid. Simple. Mechanism, same mechanism. These are primarily anti-inflammatory with some analgesic and antipyretic activity, and they are non-COX selective. The utility of this class of agents is limited by a number of adverse reactions including nausea, vomiting, diarrhea, headache and drowsiness. Means many doctors are not prescribing these, but most probably prescribes. Why they are not prescribing this mefenamic acid? Because of some of the side effects like nausea, vomiting, diarrhea, headache and drowsiness. But the doctors are giving this mefenamic acid because of its quick action for the menstrual pain. Yes, my dear brothers and sisters, these are the very very important questions for your examination, 10 mark. In next class we will discuss the 5th important question. Before going to that you remember one point here. See, if the question is like this way: classify NSAID with suitable example from each class. Write the synthesis of the ibuprofen. Here NSAID is the same as the anti-inflammatory. Okay, here you have to write what is this NSAID, then the same classification what you wrote in anti-inflammatory drugs, profens, phenamates, the same classification you have to write for NSAID. The same, everything is same, but only one synthesis of ibuprofen. Here there they have asked synthesis of the mefenamic acid, only this one. Ibuprofen, it is these are the profen, ibuprofen, yes, it is also NSAID. Ibuprofen, brufen contains this ibuprofen, 400 mg, brufen 200, 600 mg. Yeah, yes, this one is the important point I want to tell you. Yes, my dear brothers and sisters, if you are new to this channel, subscribe my channel. Let's join pharmacy. Thank you.